Hey everyone, here's a quick radiology tip for when you're reading cervical spines. I know that when we start out, we often have to count every single level. So, C1, C2, 3, 4, 5, 6, 7, T1. And that's what you kind of have to do when you're reading cases. But what I found for myself anyways is one way to kind of improve your reading speed and efficiency is to learn the pattern of what the cervical spine looks like, and to learn to kind of know which vertebral body you're looking at just by glancing at the image. And the way I specifically do that is I just always know that C5 is about this distance down from C2. So when I just look at a cervical spine, I know where C5 is immediately. And it just really helps me when I'm trying to figure out disc disease and what level I'm at, not having to continually count, not having to spend time labeling the cervical spine with numbers, which I know sometimes people will take time to do that, which is great. But when you're reading a lot of cases, if you can kind of spend a minute to learn the pattern, to do a little pattern recognition training on yourself, and every time you open a cervical spine, just kind of like point to C5 or point to C6, depending on which vertebral body you want to choose. I like C5 because there's often a lot of degenerative disc disease at C5, 6. Just every time you open a cervical spine, try to point to C5 without counting. Just point to where you think it is, and then check yourself, and you'll find that as you do that more and more, you'll get better at figuring out where you are on the cervical spine without having to count every single time. A second tip I have for cervical spines is learning where T1 is without having to count. If you notice when you look at a cervical spine, and this is something that we learned from radiographic anatomy and also basic anatomy, there's a change in the appearance of the spinous processes. So at C2, C3, C4, C5, C6, and C7 is the first vertebral body with a spinous process that looks different from the ones above it. So if you know that, C7 is the first one, and then the next one after C7 is usually T1. So you can't, this is not something I would base surgery on without counting, but I'm just saying that if you learn this pattern, you can often find where T1 is without counting. And this is actually really useful sometimes when you have an MRI of a thoracic spine and you don't have a good localizer to count down from C1. If you just need to kind of guess, at least to get ballpark level of which thoracic vertebral body you're at, you can just, if you can see the lower cervical spine and you can see this transition, you'll know that this is T1. So I can show you this on another CT as well, maybe a patient with slightly different anatomy as an example. So here's the different patient. Again, cervical alignment, it's straightened. But if you look here at C1, here's a spinous process, C2, spinous process, C3, C4, C5, C6, and you'll see that at C7 there's a change. The spinous process looks more like a thoracic spinous process, and then that tells you C7, and then the next one below that is, sorry, let me move that down, is T1. So again, this is just a helpful trick when you're just trying to figure out where you are in the spine and maybe you don't have a localizer image, or maybe you're lacking some sort of data to figure out where you are. And I can show you one more patient. All right, so here's patient number 3. Again, straightened lordosis. These are all trauma patients. That's why they probably have a little spasm or whiplash. But again, if you look at the cervical spine, C1, C2, 3, 4, 5, 6, 7 is the first one that looks more like a thoracic, and this one the transition is a little bit more gradual, but you'll see that this cervical up to C6 has a more pointed appearance, whereas the thoracic spine has more squared off shape, and then basically the second squared off spinous process is going to be T1. So give that a shot. That's and also again, just practice figuring out which vertebral body you're at just by every time you open a cervical spine. Try to name C5, and you'll see over time that you get better and better at it, and soon you won't need to count. Take care.